The main purpose of undertaking clinical incident investigation is to achieve positive change to the way in which we deliver care. Making sure our recommendations from the investigation have been implemented and have resulted in the quality improvements we had hoped is the final stage of the clinical incident investigation process. We call this closing the loop. Closing the loop begins with the recommendations that appear in our clinical incident investigation reports. Making sure our recommendations set out a clear plan for implementation, consider issues of buy-in and sustainability, and the types of measures we will use to evaluate the effectiveness of the recommendations is critical. WA Health Policy requires that the closing the loop process is undertaken in a timely manner, within 6 months of the final report being submitted. The recommendations must have been demonstrated to have been properly implemented, and they must have been evaluated to demonstrate the desired outcomes have been achieved. The process of evaluating the effectiveness of recommendations in practice is a critical part of closing the loop. There are a number of approaches to evaluating recommendations, and it's best practice to consider how the effectiveness of the recommendation will be measured at the time of writing the incident investigation report. Ideally, we would like to measure the effectiveness of the recommendation simply by demonstrating that the clinical incident has been eliminated. However, given the low frequency of many types of clinical incidents, this approach is not always appropriate. Sometimes it is more appropriate to focus on other outcome or process measures than trying to count clinical incidents. A number of different measures can be useful, such as a review of key patient metrics, such as length of stay, case note review or audit to demonstrate the processes are being used consistently, or feedback from short surveys or discussions with staff with respect to their perceptions of the change. Closing the loop is a critical part of our duty of care to our patients, our consumers, and our colleagues. When an incident occurs, it reveals to us the imperfections or gaps in how we deliver our health services. Closing the loop demonstrates that we have learned from the incident and that we have made meaningful change that has improved the quality and safety of what we do.